Where AI gets a little bit more, I'm going to say scary, is where you're looking at replicating human decisions that have a legal effect about somebody. I've been in this game for the best part of 10 years, and it feels like it's moving faster than it ever has. I feel like we are probably going through a rate of change now, which is not dissimilar to the rate of change that was going through in the Industrial Revolution.
Hello, my name's Tina Marshall, and today I've got Simon Pillinger with me, who is the Head of Information Governance, Ethics and PPI at Akrivia Health. So information governance was one of our most popular episodes actually for this podcast. So we wanted to revisit and go a little bit deeper into information governance and particularly what's happening in the world today, right now, best practice, and really also anonymisation. So anonymisation is something that comes up and is critical for data organisations like Akrivia Health. So Simon, thank you for joining me again today.
Thank you for having me.
So let's go straight into anonymisation.
Yep.
Because there are differences, aren't there, in anonymisation, de-identification, what patient data can be shared, can patient data be shared?
Yep.
So would you be able to break that down for me, please, and for everybody listening so that we can really understand the differences and the nuances between that?
Sure. So last time we talked about those kind of differences in a little bit of detail, but essentially the law differentiates between personal data and non-personal data. So it's a really binary thing to begin with. And personal data is essentially data that relates directly or indirectly to a living individual. So data isn't owned by an individual. Data protection law is very agnostic on that. So thoughts of data ownership aren't really relevant. There's some very good reasons why that's the case. But it's all about being able to infringe on someone's right to privacy lawfully, which is why to process data, we have to ensure that it's lawful, it's fair, it's transparent, and we meet all the data protection principles. So that's the first part of processing kind of personal data.
Can I just ask and interrupt? What are the data protection principles?
So the data protection principles are enshrined in Article 6 of the UK GDPR and the EU GDPR. The UK GDPR is the primary bit of legislation in the UK. And they are that data has to be processed fairly, lawfully and transparently. So that ensures you've got a legal basis for processing.
And what's classed as fairly?
So this is it's a really good question. A lot of the GDPR is really, really straightforward. Fairness, I think, is probably one of the most difficult bits to interpret. But by and large, there is kind of understood to be a disproportionate power relationship between an individual and an organisation. Organisations have more resources than individuals generally. And if you think, what's the relationship between me and Google? That probably has a lot of data relating to me. I am way, way outpowered by Google. So the fairness part is about making sure that information is processed in a way that I would reasonably expect. Again, that reasonableness is another really kind of hotly debated piece. But to give a good example in terms of bringing this back to patients. So should patients expect their data to be used in research, for example? And my answer would probably be yes. Again, this is one that's probably a little bit contested, but as part of the NHS's role in the UK is to support research. That's enshrined in the NHS Constitution. It's actually enshrined in law. I think it's Section 1E of the NHS Act 2006. And so actually, although the NHS has got a duty to care for people, to things around public health and treating patients, both as a composite body that is the UK populace and in preventative medicine, as well as you go to your GP because you've got a cough for 6 weeks, it's also got a duty to support research. And so we talked about reasons for processing data about lawful bases. Their lawful bases are that they've got duties that are enshrined in law and that they are processing that data to comply with those duties. So when you go to see your GP, the reason that the lawful basis they have for processing your data for your healthcare is that they've got that duty laid out in law and they're just complying with that. They've got, it's laid out and that's in the public interest and in law. But they've also got an imperative there in terms of helping research. Now, what it can be difficult to kind of confuse what is a reasonable person might doesn't necessarily mean what the average person on the street might mean, and that's a really confusing thing. So in law, we have this principle of the man on the Clapham omnibus, the reasonable man of English law. This goes back to a Roman legal fiction called the Pater bonus familias. I'm probably skewing my Latin, but the good family father, the good bloke who, is righteous in his community. He's upfront. He's a good member of society. What would they reasonably expect? That doesn't necessarily mean the average person on the street. So someone who's got, a fair amount of information, they would go and look at the law, they go and look at the NHS constitution. That isn't necessarily reflective of society, and that's where the contention comes in there, because what the reasonable man of English law might expect is not necessarily the same as what, if we were to stand on Oxford High Street or, Oxford Road in the middle of London, and we asked people what they reasonably thought, those might not be the same thing. And that's why, coming back to fairness, it's a really, really tricky, contentious issue. And what we see in case law is this is one of the things that is quite unpredictable. And fundamentally, we have to, it comes down to practitioners like me being able to assess the pros and cons and document that. Part of that fairness is also informing people about how their data is used. So there are duties within law, there have been for, in terms of data protection law since the beginning, to inform people about how their data is used. If you're a controller, so if you go back to the GP example, your GP's got a duty to inform you about how that data is being used, and the purposes and the lawful bases, and quite a lot of information where they're using sub-processors or processors to process that information on their behalf. And if there is a organisation that's collecting this data or from someone else, so if you're collecting it from an individual yourself, you've got a duty to inform them at that point. If you're being given that data by a third party, then you've still got a duty to inform them, unless it would require disproportionate effort. And disproportionate effort means you might have a load of pseudonymized data which you haven't got any contact details, and it would require disproportionate effort to re-identify them, to inform them.
So I think that's a really good explanation, and it leads me to want to open up to really break those elements down.
Yeah.
So for me as a patient, Tina Marshall, I go to my GP, they say, we want to use your data for research, and I say, oh my goodness, I don't want a big pharma company, or I don't want the government to know that Tina Marshall has or is or doing XYZ.
Yep.
How likely is that to happen? Does my personal information, my personal identifiable information, go over? And where is the difference there between the anonymized and the de-identified data?
Right. So some really, really... So let's break that down to a couple of things. There are certain obligations laid out in law, and there are certain kind of national policies that require NHS organisations to send reports to NHS England, to Department of Health and Social Care, and those are for often quite long-standing purposes. So things like national cancer registries, and the ability to track those sorts of information. We'll remember during the pandemic there were particular duties to report on cases. Often these are for completely reasonable purposes. They're to understand public health, they're to understand the progression of diseases. We've gone for think about disease 100 years ago, where a lot of it is infectious disease. Now we're fighting a lot of degenerative disease, just the fact that we are getting older as a population, and that causes different and sometimes more costly health things. So for the government to be able to plan that, for NHS England to be able to plan that, they need data. Now, they will pseudonymise that wherever they can.
Pseudonymise means?
So pseudonymise means... So this is where it gets a little bit fun. Has two potential meanings. So pseudonymization in a more general meaning just means to replace a direct identifier with a artificial identifier. So for example, if I were to go into a sexual health clinic, quite often people say I'm a pseudonym, is Ricky Gervais, because I don't want someone to call out my name in a sexual health clinic. If there are...
No, that would be awkward.
That would be awkward.
Yeah.
For a number of reasons.
Mm-hmm.
But the specific definition in data protection law is that actually it refers to data which has been processed and had the majority, if not all, of the direct identifiers removed. So previously, in UK law, we call it de-identification. In the Data Protection Act, actually, that's how it is referred to, but it's made very clear in the explanatory notes that those are the same things. And actually, it's an offence within the Data Protection Act to try and re-identify pseudonymised data without the permission of the controller.
That's interesting.
Yeah, so they're still personal data, but it's much harder to identify. Now, we talked about that kind of binary between personal data and anonymous data, and this is where it gets fun, because actually it's not, we look into it and it's not a binary, it's not a black and white, it is many shades of grey in between. It's a spectrum of identifiability and likelihood. So if I were to say there is a male, he's in his 30s, he lives in North Oxfordshire, he has children, he's born in the early 90s and in the first half of the year, and he's married. That probably describes a whole group of people. It describes me, but it also describes a whole lot of other people. If I say there's a guy whose first name is Simon, he lives in this postcode, he's got 3 children, he's got 3 boys, he's heterosexual, he's male, he's born in the year I'm born, I'm not going to say it on the podcast, then you are starting to provide far more identifiable information.
Yeah.
And when you're looking at the kind of information we have, like longitudinal records, it gets really hard. So one part of it is really just what information is there that you can identify. But when it comes to anonymisation, anonymisation is not really defined as a defined term in data protection law, because data protection law is only really interested in personal data. But there's and it's my favourite interview question, because it's how do you work out if it's anonymous data while you work out if it's personal data? And so actually, if you can work out whether it's personal data, and every data protection practitioner should be really good at this, you can work out whether it's anonymized data. And essentially, you're looking at the reasonable means likely to be used to identify that data. So there's a recital at 26 in the GDPR. So you have the articles, which are the bits of the law that tell you what you have to do to meet the legal conditions for processing to be lawful. And you've got the recitals, and the recitals are what the legislators were thinking and intending. So if you're ever kind of not sure how to interpret the law, you've got this huge, I think there's over 100 recitals that say, this is what we're thinking. And in recital 26, which is about how do you work out if it's personal data or not, it goes through, well, have a look at what are the means reasonably likely to be used. So, how are you going to single out information? Are you going to combine it with other information, which is called kind of mosaic re-identifications, the idea that you can take little tesserae and create an entire image? And then how much is that going to cost? What knowledge are you going to need? How much time are you going to need to spend to do that, to understand what the reasonable likelihood of identification is? And this is, I think, lots of people have tried to do this statistically, and my problem with that is that if you were to do a Venn diagram of data protection practitioners and people who know the law really well, and another circle of people who are statisticians and able to do statistics, there's probably very, very little overlap between those two circles.
Okay.
So we take a risk-based approach because the language of the law, and the law is the stick by which we measure, is a measure of likelihood and risk. And by using a risk-based approach, we can be much more scalable in our approach. We can apply those models relatively quickly. It applies integrity to apply them fairly. And the argument against this is that, well, it's very easy to kind of fudge. I think if you're doing it correctly, actually, it's not. And you might say, well, statistics is much more reliable. And it's like, but harder to implement. And what the statistics doesn't necessarily allow you to do is weight certain factors. So, for example, if you publish data, we'll find, if you were to Google anonymized data re-identified, you'll come up with a load of articles from conferences like DEF CON, from researchers whose job this is. And the characteristics of these articles in terms of re-identifying anonymized data is that the data is almost always public, and therefore actually you've got one potential barrier to prevent re-identification is removed. and that they are done by individuals with the time and resources who are dedicated to trying to prove that this concept doesn't exist. And what you'll also find is that the proportion of data within that data set that they've linked to a living individual is actually fairly small. So you get the idea of actually anonymization isn't an unreal concept. It's not an impossible concept. And anonymization doesn't mean that you've got to eliminate the possibility of an individual being identified. But you've got to take it to the point where it's so difficult it is next to, but we never say never when it comes to probability. The advantages of using anonymized data is that it falls outside the scope of data protection law. But you have to continually assess, look what the technologies are around you to be able to, that might actually mean that your data isn't as anonymous as you first appraised it to be.
Yeah, so how can that data be protected? Like, how am I supposed to trust an organization that says, oh, I'm only going to use the anonymized data, but then they're sent my personal data, or are they sent my personal data?
It's a really good... So, personal data is also going to be a little bit relative as well. So it's based on how easily can a person identify someone from that information. This gets a little bit confusing because courts tend to kind of go round in circles on this. So recently we had a ruling from the CJEU, the Court of Justice of the European Union, which, although in the UK we're no longer part of the EU, the laws are substantially similar. That it's really, you can apply the laws are substantially similar, that you can compare the principles that they've come out with. So you can look at judgments from the Court of Justice of the EU and you can say, actually, that's just as applicable in our context. And actually, this was SRB versus EDPS, if anyone wants to look it up. And the judgment in that was really interesting in saying, actually, it might have been... so it was a controller, she had a bit of data with a processor, and essentially they said it was identifiable to the controller, but not to the processor. All it was a couple of opinions, and they were doing some kind of categorization work. And so there is a point that actually identifiability is relative to the organization.
Like the activity.
Absolutely, it's and to the beholder.
Yeah.
What we do is, I think the way that this sort of assessment should be done is that you have a look at who it's assessing how anonymous a piece of data is, or a data set is, to your own organization, and that includes, looking at what other data you have as a controller or process as a processor even. It involves looking at who you've got working in your organization. So if you're an organization like Akrivia with loads of really clever scientists who've got statistics at their beck and call, then, does that increase your risk? Probably. But then you've got to have a look at what are their motives, you've got to have a look at their likelihood, you've got to have a look at all the access controls in place. If you're making this available for third parties or, customers how are you controlling that access? Are you providing aggregate levels of information, which would be the kind of best possible outcome, because there are some, you can apply very solid statistical controls to that. So things like K anonymity equals 5 is the kind of general consensus as being the gold standard, or one of them. Again, this gets really contentious, this field. And then look at what are the purposes, how are you curating that data set. You can still apply a lot of the data protection principles, so you use as little data as necessary to achieve your purpose. So although it's not within the scope of data protection law anymore, it still behooves organisations to treat anonymisation with the same principles that are applied, because they're good principles to use.
Okay, thank you for that. And so going into information governance in the tech world, and with AI, the buzzword AI, which I always find really interesting, because I just see it as like it's another sector. But for AI, how can information? What are the challenges or the watch outs? I would say the things that people should be mindful of.
So I'm a Harry Potter fan, so I always remember the phrase from the second book, which is when so one of the characters is enchanted by an enchanted book, and her dad says, after everything's kind of gone down, says, don't trust anything where you can't see where it keeps its brain. And I think one of the really big pitfalls of some AI uses is that we don't necessarily know how they work. If you're doing your assessment of a product that's using AI, it's difficult to understand what data goes in and what data comes out. Now, that could be, and this kind of comes back to, there are different uses of AI. So you've got some things like what we do at Akrivia is natural language processing, which is essentially being able to use AI to structure information. It speeds up what would otherwise be a human task. It's replicating judgment to a certain extent, but it's only on words. And it's, we can do validation things on that. Where AI gets a little bit more, I'm going to say scary, is where you're looking at replicating human decisions that have a legal effect about somebody. So, for example, if we start getting into kind of health tech, do we go down the route of AI assisted decision making? And there's a really good book on this, which is Kathy McNeil's Weapons of Math Destruction. She was working in investment banking during the crash in 08, 09, and her take on kind of some of the decision-making things that are going on. GDPR has right not to be subjected to automated decision making where it has a legal effect on that person. So, for example, there are tools out there that will scan CVs and give people a rating out of that, which might mean they get a job or don't get a job. I think
that's worrying. Somebody might just be bad at writing a CV.
Yeah, exactly. I mean, there's a whole other question that this brings, which is actually how good are humans at doing these tasks.
Yeah.
And I think this is the really interesting thing, is it kind of gives us pause to question. Yeah, computers might not do these tasks very well, but we prefer humans not to do those tasks very well as well. And there's some really good studies about the UK judiciary in relation to judges passing harsher or more lenient sentences based on the time of day, based on how close it is to lunchtime.
Really?
Yeah, and this kind of comes back to that point of,
so based on their own emotions, their own prejudices, again, I guess, even though they shouldn't take it into account, they probably, unconscious bias is
absolutely. And this is a profession which they are there to judge. And they are probably still some of the most impartial people in that. And, anyone who's read enough kind of summaries of judgments has been... It's probably to know that, they are far from, or whatever that Daily Mail headline was, the enemies of the people. I think they're far from that. But the point remains is actually, before we, I think people are generally more comfortable, even then,
with
having
a person than a machine.
Absolutely. Because the person is human and
has emotions.
Yeah, and I think is inputting all those factors that are human.
And has experience.
Absolutely. And, that's for better and for ill as well. I think where we're seeing lots of kind of progression, I think, on AI regulation. I think that is the way to go. I think the other thing this comes back to is a data protection principle, which is to understand your purpose. And it's making sure that you process the data that's necessary for that purpose. I think what's really tempting with AI is to go, oh, there's a great AI tool. And there was this horror of the story that came out of the US where I think a policeman had taken DNA sample, run it through analysis, got the alleles for certain kind of phenotypic characteristics like eye, color, generated a artist's impression from that genetic information and put it through a facial recognition scanner. So you can see several layers of potential failure that could lead to harm to an individual and potentially a miscarriage of justice. And all of that is because you haven't got the processes in place to kind of understand, what am I trying to achieve? Is this the way to do it? Are there potential harms to innocent people? And when we get that wrong, it damages our confidence as a society with the whole system.
Yeah. What would you say would be, somebody's new coming into the profession, or even if they're not new, they're moving into a new sector or something like that. But what would you say would be your top 5, key points to really develop best practice for information governance in this changing sector with evolving technology?
network. So there are some absolutely brilliant people pushing out commentary and content on forums like LinkedIn.
Who are they?
So
Like,
people like Rob Bateman is one of the people that kind of comes to
okay.
mind. He's done a lot on kind of the development of US data protection law. Dara O'Brien and Carey Leeming from Castlebridge over in Ireland have produced some really good books on digital ethics.
Okay.
And in fact, Dara O'Brien did a fantastic piece on ChatGPT when it came out, and he'd searched for books on digital ethics, and he was slightly annoyed that his own one hadn't come back, but also 7 out of the other 10 books didn't exist, or he couldn't find any record of them.
Interesting.
More than I can probably really name.
Yeah.
There are just we can probably do some shout outs. There's a great kind of convening of people. There's a event I go to twice a year called Privacy Space, which brings together data protection practitioners, both kind of veterans of the field, but also kind of newcomers. If you're in a health tech space, there's people like Barry Molt, Andrew Harvey, and Richard Newell, and just people who are really good to know in that sector. People who've got a lot of experience, way more experience and time than I've spent in it, who can provide you
You seem quite
sector-specific advice.
experienced, Simon. You know what you're talking about.
I know I'm good. I can talk, but there are, it's building those networks, getting to know people, and quite often data protection specialists can find themselves isolated in an organisation in terms of expertise and knowledge. It's really important and crucial to have people that you can go and sense check things, because if you're the sole IG person, or in fact if you're the sole specialist in any organisation,
Yeah.
you can have yourself thinking, I know this, but I just need to check, because actually the advice you give is often is gospel. That's the way that specialists work. It is followed, and you want to make sure you give the right guidance, particularly if that guidance is not going to help the business. That's the reality of regulatory affairs. The other key bit of guidance I would give is read one bit of case law a week, or one ISO decision a week.
Okay.
It will help you build up your knowledge of the application of the law.
Yep.
And the other thing is, you don't read law, you reread it, and you reread it, and you reread it until you probably don't know which article you're thinking of, but you probably aren't going to remember every single clause and every single article and every single recital, but you'll have an inkling of where you've got to go back to check. Practicing law, and I don't practice law in the kind of professional sense, but being a practitioner in a field around law means that you almost certainly will have to go back and double check the legislation, because there is a lot out there. There's case law being generated at ever greater pace. So
it is constantly evolving then. It's not like a fixed law.
No, absolutely.
It's constantly evolving. New legislation, changing all the time.
And I've talked to people like Barry Molt, who's been around in this business for since the Data Protection Act 1984 came out. And I said, I've been in this game for the best part of 10 years. And it feels like it's moving faster than it ever has. I said, is that just me not being as long in the game? He said, no, it is. So if you think about, you had the Data Protection Act 1984, then you had the 1998, and you had the FOI Act 2002, I think it is, or 2000. It came in 2002 in action. And then you've had the GDPR published in 2016, come into force in 2018. You've got the Data Protection Act, which was, I think, when royal assent on the 24th of May 2018, just before the GDPR came into force. And then we've had goodness knows how many amendments to the Data Protection Act following leaving the European Union. So we've had that. Everything has become so much more complex. The rate of change has increased. And that's partly, I think, a response to the rate of technology is increasing. I feel like we are probably going through a rate of change now, which is not dissimilar to the rate of change that was going through in the Industrial Revolution. We are seeing ways, in this way that kind of manufacturing was revolutionized in that time, we are seeing information manufacturing and usage going through whole new shades of acceleration. It has never been easier to kind of profile people and gather information about them. And I think the regulation is keeping up with that, or at least trying to. I think some of the principles, though, from Data Protection Act 1998, actually a lot of those principles have carried over into the GDPR.
Yeah.
What we're seeing is just the rate of, how those principles in law are really simple. The application into life, into the world, is complex. So keeping on top of those, and that comes back to reading a bit of case law each week, reading an ICO decision, and even if you are a practitioner not working in the public sector, read freedom of information requests and the decisions from that, because a lot of data protection case law...
So where do you find those then, freedom of information requests?
ICO website. So the ICO website publish their decision notices. So they publish enforcement notices, which are when they've taken enforcement. Decision notices are where they've kind of had a particular complaint or a freedom of information request hasn't been responded to. And the reason I'd say about reading FOI is that FOI requests have created quite a bit of case law that relates to data protection, because people will ask, for this information, and you can't ask for personal data under FOI, and so it generates lovely bits of case law, and because FOI requests are frequently made, it generates a high proportion. So my guidance would be is that even if you're not in public sector, go through them, because there are some gems of knowledge in there. The other person probably to follow is Tim Turner, and his page DPO Daily. He is a fantastic textual analyst of law, and it comes out with some really good nuggets of how to apply. He's also just a fantastic communicator.
Okay. Learn on lots of different levels.
Yeah.
Thank you. Do you have any last thoughts to share?
I think if you are in a data protection practitioner or a DPO and you are selling into another organisation, if you are, often people in NHS organisations, governance people have got a lot coming across their desk. The best way to stand out is to make their life as easy as possible. Mm-hmm. So if you are part of health tech developing a product, get data protection involved as soon as possible as part of the privacy by design default. If you are, actually, it's probably the bit of guidance is not for DPOs. They know what they're doing. It's for founders in health tech. If you're building a product,
get the DPO involved.
Get data protection involved. By privacy by design default, it's going to cause you fewer problems downstream.
Yeah.
If you've got these data protection, if the worst possible way is, it's the cost of doing business. But the best possible way, if you're in health tech, the likelihood is that you want to help patients. And you help patients by, making it
getting the right thing out to them sooner.
Absolutely. Mm-hmm. And if you go to a DPO, an NHS organisation, and you've not done those things, they'll send you back. If you send them something which makes their job as easy as possible, you will stand out because the bar is not high.
Yeah.
So get them involved as soon as possible. Take it as an opportunity to save costs in the long run, but also to data protection practitioners are often really good business analysts because they have to look at the whole. So you really start to understand what your product is for and what you need to power it. So if you're looking at a journey across a desert, you want to know how much fuel and water you've got to take with you. If you're building a product, you've got to work out where you've got to get to. You've got to work out what data is going to fuel that. If you do data protection by design, you're sailing.
Okay, perfect. Thank you very much. Data protection by design, keep it in mind. Thank you very much to Simon Pillinger. And do follow Simon on LinkedIn. He didn't give himself a shout out then, but I will. He's got some really good content. Some slightly quirky and crazy content, but it always makes information governance really easy to understand, particularly from my perspective. So thank you.
Thank you.